we're talking about something that's revolutionary. We saw some information on it. Now go ahead and explain what we have here and give us a quick run through.
All right, absolutely. So basically here we have the spine. Normally when we're talking about a spinal cord stimulation, we can put it anywhere throughout the spine. But for the most part, we typically put it for lower back conditions. So someone who might be suffering from chronic sciatica or chronic pinched nerve in the back that already have surgery and they still persist with pain is one of the most common indications for spinal cord stimulation, as far as we don't have any other cause that might be causing those symptoms. So meaning a newly developed disc herniation, another arthritis that might be pinching up on the nerve. But that's what the scans are for, to make sure and rule out that people have those things. So when we have exhausted all medical options, the stimulator will be a reasonable procedure to do. So this procedure, we do them under X-ray guidance. So normally what we do is that we place the patient facing down on an X-ray table, as you were seeing before on the clip.
It will help if I hold this, maybe. And
absolutely, you can hold my back.
Go ahead. I've always wanted to hold a doctor's back, and I feel so much better now.
I feel better now. Yeah. So basically, we insert a needle using direct X-ray visualization. So we get the needle in place. We have one of these wires that we put in the spine. Normally, most of the time we put two. So if you can see, they have some metals in here. Those are the metals that they send electricity or signal to the spinal cord. So essentially, once we put a needle, we drive this wire underneath this, in the spine, okay, and we take it to a specific area where we want to target or stimulate the spinal cord. So eventually, what it does is just send signals down to the spinal cord. So that way, the spinal cord sends the signal to the brain. So at that point, it's blocking what we call the pain signal. The brain doesn't perceive the pain, and instead of where the symptoms are in the leg, people are going to feel either a buzzing sensation or a tingling sensation. Nowadays...
but you say no more buzz.
Correct. And nowadays, we have been, there's some research that we can do stimulation without buzzing itself. So people, they don't feel anything at all in their leg. So basically, we'll be feeling like they feel like their arm if they don't have any pain.